What's going on, everybody? In this episode, we're going to talk about Achilles tendinopathies. Let's kick things off with talking about the Achilles tendon. So, the Achilles tendon is a big tendon on the back side of the heel. It connects the calf muscles, which are the gastrocnemius and the soleus muscles. Both of those taper down to form the Achilles tendon, which then wraps around the heel and inserts on the plantar fascia. So the main purpose of the Achilles tendon is to transmit force from the bottom of the foot up to the calf and then vice versa. So every time you take a step, when you land, the forces from the ground actually transmit from the bottom of the foot up through the Achilles tendon and then up to the muscles, which are again the gastroc and the soleus muscles. And then as we take that step again and we start to push off, then all the force generated from the calf muscles transmits down into the Achilles tendon, down through the plantar fascia, and then to the ground to accelerate the body forward. Achilles tendinopathy is considered to be an overload syndrome. So essentially what that means is that we've put too much stress in too short of a time on the Achilles tendon, and that's what leads to pain. So any sport that involves running or jumping will be susceptible to Achilles tendinopathies. So if we're looking at running sports, whether you're training for a 5K, 10K, marathon, triathlon, all of those, or just a sport that involves running, so soccer and football are the two big ones. And then if we look at jumping sports, volleyball and basketball are the two big sports that require jumping. So all of those sports and activities have a more likely chance of developing Achilles tendon problems, just because their sport requires so much load on the Achilles tendon. When we look at treatment for Achilles tendinopathy, it's changed as our knowledge of Achilles tendon problems has changed. So it used to be that we'd call Achilles tendon problems either tendonitis or tendinosis. And when we called them tendonitis, which inferred that there was inflammation that was driving the pain, we would use a lot of anti-inflammatory strategies. So we would use like RICE or PRICE, so we do rest, ice, compression, and elevation, trying to get the inflammation out of the tendon. Where if we had the tendinosis, which meant that there was degeneration of the tendon, then we would try some muscle regenerative strategies. So we do like PRP or something like that to help build the tendon up again. And the problem with tendonitis and tendinosis is that they don't fully encapsulate what constitutes as a tendon problem. And so now that's the reason why we use tendinopathy, which kind of takes a little bit of both from the tendonitis and the tendinosis model and puts them together into a big continuum instead. Currently, the best treatment for tendinopathies is exercise and load management. So because it's an overload syndrome, load management means that we're going to reduce the load that we're putting on the Achilles tendon. There's three main variables that we can modify to help reduce the load. So we can change the intensity of the exercises. So typically high loads in quick time frames put a lot of stress on the Achilles tendon. So if we're doing a lot of sprinting, jumping, cutting motions, stuff like that, we'll want to temporarily avoid those so that the tendon can calm down. The second factor is that we can change the frequency of exercise. So that just means how often we're exercising in a given time. So let's say you're a runner training for a triathlon or something like that, and you're running 3 times a week. We can reduce that so it's only twice or 1 time a week, and that'll give the tendon enough time to rest in between exercise periods. And the research kind of shows that the collagen turnover in tendons is about 48 to 72 hours. So especially when we're starting to load it a little bit more, we want to make sure that we have adequate amount of rest times in between our exercise programs. And the third factor is volume. So that is pretty much synonymous with duration. And so that refers to how long we're exercising or how far we're going to exercise for. So if we're running, that would be every run, we're running 5 miles or 10 miles or something like that. Or it's playing soccer for 90 minutes or whatever your sport kind of requires. So we can also tweak the volume of exercise so we can reduce that as well. Out of all three of those, intensity seems to be the most important one to modify, in that we can load the Achilles tendon slowly, and so we can still exercise a little bit more regularly or as often as we used to, But if we're putting a lot of stress on the Achilles tendon, so we're doing a lot of those sprinting, running, quick motions that put a lot of force through the Achilles tendon, it's going to probably continue to irritate the tendon. So out of all three of those factors, intensity seems to be the main focus when we're trying to reduce the load on the Achilles tendon. For the exercise program, we want to gradually progress the stress that we're putting on the Achilles tendon. So in the beginning, we'll start off with isometric exercises. And an isometric exercise is one where you contract the muscle, but you don't actually move the joint. So for the Achilles tendon, that would just be standing on your tippy toes, which will be shown right here. We can also do walking on your tippy toes as an exercise, just because you're up on your toes and you're not actually moving the ankle joint, so we're not doing heel raises or something like that. And isometric exercises have actually been shown to have an analgesic effect on tendon pain cases. So we'll typically hold these for somewhere between 40 to 60 seconds and then repeat for 4 to 5 reps. And in between each rep, we want to have about a minute to 2 minutes of rest. And for the isometric exercises to produce that pain relieving effect, we actually need to load them fairly heavily. So we want to try to put as much load as we can that's tolerable for the person. So generally the recommendation is about 70% of your maximum weight that you could do a heel raise for. Obviously, if that generates pain, then we can reduce it. But the idea is that we have to put some load on the Achilles tendon with an isometric contraction to stimulate that pain relieving effect. Once we're able to do the isometric exercises with minimal discomfort in the Achilles tendon, then we can progress to strength training for the Achilles tendon. So now we're really focused on building more Achilles tendon, and that will help increase the capacity so that we don't overload it with our activities before. With strength training, we want to do them every other day, and that has to do with the turnover of the Achilles tendon fibers. So as we were talking about before, it typically takes somewhere between 48 to 72 hours. And so we want to just make sure that the Achilles tendon has enough time to recover before we start the exercise over again. And as we progress, we can start doing the heel raises a little bit more quickly and eventually transition into plyometric exercises, which would be all the things that we were talking about before. So that would be sprinting, running, and jumping. And so we just want to make sure that as we're rehabbing an Achilles tendon issue, that we're building a big foundation. So we want to make sure that we're strong and that our Achilles tendon can tolerate the loads of a really quick contraction. There are a couple adjunct therapies that we can use with Achilles tendon problems, and they're mainly focused on just decreasing the pain so that exercise is a little bit more tolerable. Soft tissue therapy, so either like Graston, iStim, manual work with your hands, that could be used on like the calf and also the Achilles tendon to help reduce some of the pain with the movements. It's important to kind of note that the reason why you would do these adjunct therapies is really to facilitate exercise, and it's not the other way around. Sometimes we put too much emphasis on these other adjunct therapies, so joint manipulation, soft tissue therapy, injections, all these other things, but really the focus and the main treatment for Achilles tendon problems is exercise. So we just want to make sure that we can incorporate some of these adjunct therapies, but they're just that, they're adjunct therapies. Another important note when we look at tendon problems, specifically with the Achilles tendon, is that sometimes we feel like the calf is tight or the Achilles tendon is tight, and so we want to stretch it. And the problem with stretching the Achilles tendon is that tendons don't do well with compression against the bone, especially prolonged contraction against the bone. So if it's already irritated and you do the typical calf stretch, well, you're compressing that Achilles tendon against the heel bone, which is called the calcaneus, and that can lead to further irritation. So when we're rehabbing an Achilles tendon problem, we temporarily want to avoid stretching that area just so that we can help calm it down and build it back up versus continually irritate it through the treatment process. So in summary, the treatment for Achilles tendon problems is twofold. So we want to control the load that we're placing on the Achilles tendon. There's a couple ways we can do that, either through modifying the intensity, the volume, or the frequency of exercise. Typically, we want to focus mostly on intensity when we're modifying the load, but also we have the volume and also the frequency of exercise that we can tweak as well. When we look at actually the treatment for Achilles tendinopathies, it's exercise, and it's a graduated exercise program. So we want to start from an isometric contraction, going into strengthening involving both concentric and eccentric muscle contractions, and then finally going into plyometric exercises, which would be running, sprinting, or jumping. Thank you guys so much for watching another episode of Monday Mornings with Michael. I hope that you guys found this information useful. If you did, please like this video and don't forget to subscribe. Until then, I'm just going to hold this plank until you go ahead and push subscribe. Go ahead and push subscribe. I don't know how long I can hold this plank. Just click that button right there.